There are three different arteries. The large, medium, and a small size artery, elastic artery, muscular artery, and arterial. Elastic artery or conductive artery, such as aortic and pulmonary artery, is large with diameter up to 2.5 centimeter, transport the blood and nutrition from the heart to tissue, include the pulmonary aortic trunk and another artery. And muscular artery have a thinner tunica media than elastic artery, and the internal elastic lamina and external elastic lamina in the muscular artery is sharp, and in the arterial it has a 3 layer, but the smooth muscle is a very thin layer. This is the elastic histological figure of elastic artery. Elastic artery contain of endocardium, endothelium, subendothelium, endothelium layer, and tunica media. Tunica media contain of the many and numerous elastic fiber. Because the elastic fiber is located in the tunica media, internal elastic and external elastic lamina is very difficult for distinguish, because the tunica media contain of many elastic fiber. This is elastic artery contain of endothelium and subendothelial connective tissue, and tunica media contain of 70 elastic lamina, and tunica adventitia is very thin. This is a schematic picture of elastic artery. Tunica intima, tunica media, and tunica adventitia is very thin. In the tunica media, furthermore, the smooth muscle, you can see an elastic fiber between the smooth muscles. This is a special staining for elastic fiber. It's dark. Elastic arteries such as the aorta and pulmonary artery, and another large artery in the body. Muscular artery or distributing artery contain of tunica intima, media, and adventitia. The tunica intima is thinner, and internal elastic membrane or lamina is prominent in the muscular artery, and the tunica media contain of the between 10 to 40 layer of smooth muscles. And in a small muscular artery, there are 3 to 10 layer of smooth muscle in this layer. And the elastic material is low and contain of collagen fiber, and external elastic lamina is prominent in this tunica media. And tunica adventitia contain of fibroblast, elastic fiber, adipose tissue, and in the large muscular artery contain of vasa vasorum and nerve fiber. This is the muscular or distributing artery, and the tunica media is thicker and contain of 10 or 50 layer of smooth muscle layer. And the internal elastic and external elastic lamina is prominent in the muscular artery. This is the muscular artery. Internal elastic lamina as separated the tunica intima from tunica media, and this is external elastic lamina is located between the tunica media. This is the schematic picture of the muscular artery. You can see a tunica intima contain of endothelial cell and located on the basement membrane, and internal elastic lamina and external elastic lamina is prominent in the muscular artery. Actually, internal elastic lamina is located between tunica intima and tunica media, and the external elastic lamina is located between tunica media and tunica adventitia, and is prominent in the muscular artery. A small artery has between 3 or 4 layers of smooth muscles in the tunica media, and the internal and external elastic lamina don't appear in this layer. This is a small muscular artery and arteriole. Arteriole, such as the layer of the artery contain of tunica intima, media, and adventitia, but the tunica intima is a contain of only endothelium, and subendothelial layer is lacking in this layer, and tunica media is contain of 1 or 2 layer of smooth muscle cells, and tunica adventitia don't has external elastic membrane, and the connective tissue is very decreased in this layer. This is the arteriole, contain of tunica intima and tunica media. Is a 1 or 2 layer of smooth muscle, and this is a tunica adventitia. But in this picture you can see a venule. The lumen of the vein is large and irregular compared to artery, but in this artery the lumen of the vessel is regular and circular shape compared to lumen of the vein. Okay, another type of the vessel in circulatory system is the capillary and the vein. The vein is divided to 3 types: small, medium, and large. And the capillary is a network located between the artery and vein. An exchange of oxygen and nitrogen and carbon dioxide is occurring in the capillary network. The artery is divided to elastic artery, muscular artery, and a small artery or arteriole, and you can see differences between these vessels. After the artery you can see capillary and vein. The vein is divided to large size, medium size, and venule, the small size. This is a capillary as a location for exchange of nutrition and oxygen. In this capillary there are contracted smooth cell as a precise cell as a sphincter around the capillary. There are the arteriovenous shunt in the body, and in this body in the skin. The arteriovenous anastomos or shunt connection between the arteriole and venule that bypass the capillary bed, and this located in the skin and useful in thermoregulation in the skin. But the capillary is divided the three types, and diameter of capillary is between the 790 micrometer, and there's location for exchange of the vessels, and contain of the one layer of endothelial cell and basement membrane. And endothelial cell, between the endothelial cell you can see a tight junction, and pre-site cell in capillary and post-capillary venule, and as a contracted cell, and contain of actin and myosin, and the contraction is around the capillary and has a repairing rolling. Capillary is divided the three types: continuous, capillary fenestrate, and sinusoidal capillary. The diameter of the capillary between the 4 to 10 micron. This is a continuous capillary, and continuous capillary is located in the muscle, lungs, and central nervous system. Between the squamous cells, there are the tight junction, and numerous pre-site cells around the capillary. Pre-site cell or Roget cells around the continuous capillary. Now this is the basement membrane and simple squamous cells, and around the basement membrane you can see a pre-site cell. But in the fenestrate capillary, the wall of the endothelium is fenestrate and has a pore. The diameter of fenestration is between 80 or 100 nanometer, and it has a pinocytosic vesicle for exchange of the material, and fenestrate capillary is seen in the endocrine gland, gallbladder, and gastrointestinal tract. But the basement membrane don't has a pore, and it's around the squamous cells. The three type of capillary is sinusoidal capillary, and the basement membrane is discontinuous, and there are the pore in the cells and basement membrane. The sinusoidal capillary is located in the liver, spleen, and bone marrow. This is a schematic picture of the capillary, continuous capillary. Contain of there is a tight junction between the endothelium cell, and it has a transcytosis between the cell for exchange the material. In the fenestrate capillary, the endothelium cell has many fenestrate between the 80 to 100 nanometer diameter, but the basal lamina or basement membrane is continuous. In the sinusoidal or discontinuous capillary, both of them, the cells and basement membrane, is discontinuous, and the sinusoidal capillary is seen in the spleen and bone marrow, and the both of the cell and basement membrane has a fenestrate. This is comparison between the arteries and vein. The tunica media in the artery is thicker than the vein, but the tunica adventitia in the vein is thicker compared the artery. The lumen of artery is regular and circular, but the lumen of the vein is large and irregular shape. But the vein return the blood to the heart and divided to large and medium and a small vein. In the vein, the endothelium contain of the flap and valve because for the helping the returning the blood anti-gravity in the body. For example, the blood return from the lower limb to the heart, and the existence of the valve is help to returning to the blood to lower limb. And if the valve is don't has a normal shape, produce the this is, for example, varus vein. This is the normal vein and this is the varicose vein. The shape of the valve is abnormal. And then a small vein or venule, it has a just endothelium and a precise cell. In the muscular venule or large venule, the diameter between the 50 to 100 micrometer, and there is a 1-2 layer of a smooth muscle in the tunica media. And in the small medium, the diameter between 100 micrometer to 1000 micrometer, and it has a thin media, only a few layers of smooth muscles, and it has a much thicker adventitia contain of collagen and adipose tissue. And finally, the lymphatic system is adjacent to circulatory system, and lymphatic circulation collect the fluid between the tissue and return to blood circulation. And there are the lymph node in the body for immunological response in the body. The lymphatic system started from the duct between the tissue, and in the histologically contain of the endothelium, just the endothelium, and drain in the lymphatic drainage in the left side. The finally drain to thoracic duct, but the right side drain to the right bronchomediastinal trunk, and near the junction of interjugular vein and subclavian vein. This is a thoracic duct. And histologically is contain of the endothelium cell, and the similar to vein structure is similar to vein and contain a valve. And I hope the subject is help to education, and if you have any question, please write the question in LMS system. Good luck.